Blood supply. Blood supply of the face, the major artery of the face, you can easily guess it by the name, that will be the facial artery. That will be the facial artery. So, facial artery. We in the lecture in the neck, the second lecture of the neck, the one where we discuss the arteries, not the second one, it was the third one. The third lecture of the neck, where we discuss the arteries, the branches of the external carotid, the branches of the subclavian. In that lecture, we discussed how does it arise from the external carotid artery, how does it reaches the lower margin of the face by coming through the submandibular fossa, and on the pathway it was giving rise in the neck, it was giving rise to the tonsillar and ascending palatine branches. In the mandibular fossa it was giving mental branches. So that discussion and that pictures we will able to find there in the lecture, in the third lecture of the neck. We will take it from here. While for discussing the arteries of the face, you must know where does it enter the face. If you sit here and clench your teeth, let me get to the 3D model. If you sit and clench your teeth, you will see this muscle that is known as the masseter muscle. The masseter muscle helps you guide the presence of the artery in front of it. So here the facial artery is entering the face just in front of the origin of the masseter muscle here. In some people, but rather we would say in a lot of people, the bone is notched here. You may able to see, feel a notch of the bone right here, and if you're not able to see the notch of the bone, palpate the notch of the bone here, you can clench your mandible, find its interior margin, find where it meets the lower margin of the mandible, and this is the point where facial artery enters the face. You can actually put your finger and palpate it right here. Okay, from here it has to move up, and for have to move up, you have to remember 3 points. This point, remember this point at the anterior margin of the origin of the masseter, its junction with the inferior mandibular margin. Second point is just a centimeter or more lateral to the angle of mouth. Third is just medial to the angle of the mouth. If you remember these points, you will be able to describe whole of the pathway of the muscle. So it is running from this point to the angle of the mouth and all the way to the angle of the medial angle of the eye. So this is the facial nerve. It is running beneath the muscles coming radially. It is superficial to the buccinator, but it is deep to the levator muscles, levator labii and all of them. It is superficial to the levator anguli, but it is deep to both of them. Which branches does it give? Here, the branch that is given here, it is the mental branch. Submental artery, it is going to the submental triangle. Then as it moves to the angle of the mouth, it gives rise to 2 branches, one for each lip. The one that is going to the lower lip, inferior labial artery. The one that is going to the upper lip, superior labial artery. Follow up, it will give branch to the nose. It will give branch to the side of the nose. That is called lateral nasal branch. And it ends here, terminating at the medial angle of the eye. It may communicate with the artery exiting the eye, that is known as dorsal nasal artery. Keep in mind the artery exiting here and the nerve exiting here have both different names. The artery that is exiting here is dorsal nasal artery. The nerve that was exiting here was infratrochlear nerve. Apart from these arteries, there is two arteries that are supplying different aspects of the face. First, this artery that is going all the way up. This one. This is called superficial temporal artery. That is called superficial temporal artery. It was the terminal branch of external carotid artery that is going to supply the superficial aspect of the temporal fossa. So it will go and it will divide into many branches: the middle branch, zygomatic-orbital branch, the frontal branch, the parietal branch, the auricular branch. There will be many branches that will be spreading out from the superficial temporal artery to supply the area around the temple. Keep in mind this artery. This is the zygomatico orbital or branch that is going to enter the temporal fossa. We will discuss it later. And then there is this artery that is an important one. That is the one that is coming on the anterior aspect, and it is running transversely across the face all the way to the front of the cheek. That is known as transverse facial artery. So this is all the discussion about the arteries of the face, and apart from it, there are arteries that are exiting the orbit along with all the branches. There are arteries that are exiting the orbit along with all the branches. Those will be the same named arteries. The one that is exiting along the supraorbital will be supraorbital nerve artery. Along the supratrochlear will be the supratrochlear nerve. From the lacrimal, near the lacrimal, that will be lacrimal artery. From the two openings, zygomaticofacial and zygomaticotemporal, the same one will be there. And we are left with infraorbital artery. So the point I am trying to make it, all the nerves we discussed coming out of the different foramina of the orbit will contains the arteries by the same name. There will be only one discrepancy in the name, and that we discussed was for this artery. This nerve was named here, the nerve was named as infratrochlear nerve, but here the artery, it is named as dorsal nasal artery. So this is about it. The different branches, the supratrochlear, supraorbital, zygomatic, temporal are not shown in here, but we can see them right here. So these are all the branches, and here one important thing comes into play, that all of the arteries exiting the eye, supraorbital, supratrochlear, zygomaticofacial, zygomaticotemporal, infraorbital, and dorsal nasal, those are all ultimately branches of the ophthalmic artery. Ophthalmic artery was the branch of internal carotid artery. So there is a connection between the branches of ophthalmic artery and the branches of external carotid artery, superficial, temporal, facial, as they come to the face. So there is a connection between the two circulation, internal carotid and external carotid circulation, as it comes to the surface. So this is the latest picture, and they have, in this particular picture, I'm leaving it for you for taking a screenshot. They have shown in blue and red the arteries that are coming from ophthalmic artery, and the arteries that internal circulation, internal carotid circulation, and the arteries that are coming from external carotid artery. So this is all about the blood supply. Talking about the venous drainage, there will be the same veins: supraorbital, supratrochlear, supraorbital, zygomaticofacial, lacrimal, zygomaticotemporal, infraorbital, superficial, temporal, facial vein with all its the same tributaries, but they will have a different draining points for some of them. Let's talk about the superficial temporal. We talked about it yesterday also in the last lecture, but we'll discuss it again. The superficial temporal vein joins the maxillary vein to form the retromandibular vein. There is no external carotid vein. It forms the retromandibular vein. In a retromandibular vein, as it comes down, it is superficial temporal vein. From pterygoid plexus, they are coming the maxillary vein. They are forming the retromandibular vein. The retromandibular vein, as it comes down, it breaks. It breaks into an anterior division, and it breaks into the posterior division. The anterior division is called and joins the facial artery, facial vein. Posterior division joins the posterior auricular vein to form the external jugular vein. Here, the thing I want to focus is these connections. You can see in the infratemporal fossa, there is this pterygoid venous plexus. This pterygoid venous plexus is communicating through the retromandibular vein, through maxillary vein, but it is also communicating through the facial vein, through this vein that is known as deep facial vein. And it is connecting through foramen ovale, spinosum, lacerum to the cavernous sinus above. So all of these veins have a connection to the cavernous sinus above. Second, the arteries on the medial angle of the eye, on the lateral aspect of nose, they are connected to the eyes inside the orbit, the superior and inferior ophthalmic vein. These veins join the facial vein in front to the cavernous sinus back, because they have ultimately to drain into the cavernous sinus. So you can see from this tip of the nose, this point, through the ophthalmic veins, and from the angle of the mouth through the deep facial vein and dirigoid venous plexus, this area is ultimately joining, and area is ultimately having a potential connection with the what, with the cavernous venous sinus. So any infection, that usually the blood don't follow this pathway, but if due to any reason there is a block in this way, or due to some other reason, due to some any blockage, blood may move back to the cavernous sinus, and if the blood is infected, it may move back to the sinus, and it will lead to cavernous sinus thrombosis. And here is the one that we tend to pop our pimples like this, and if we press too much and the pimples pop in the inside, they will move through these veins and reach the cavernous sinus, where they will endanger the formation of the cavernous venous thrombosis. So this is known as danger area of face. You are advised uh, not to leave this area alone, not to manipulate it too much, otherwise you may drive a risk of developing cavernous sinus thrombosis. Lymphatics we have discussed in the previous lecture, but one formula I wanted to discuss right here. You just discuss the facial artery. Let me draw the facial artery. It will be from this point to the angle of the mouth to the this. So this is the facial artery, this line. So beyond the facial artery, if we start something beyond the facial artery, this area, it leads to the parotid nodes, the one that is in front of the parotid gland, in front of the ear. The mastoid, the preauricular nodes and parotid nodes, the one over the cheek will be buccal nodes, and the area all the way down, it will go to the submandibular nodes. And then the other area that we have to know is the four incisors, two on this side, two on this side. This area it drains into the submental node. The area that is lateral to the facial artery, it drains to the parotid nodes, and the area that is between the two, that is draining into the submandibular node. And this middle one area, it has buccal nodes in the pathway. So this is all about the lymphatics of the face, the nodes, buccal, submental, submandibular, preauricular. So, and behind the face, there is this, just behind the ear, there is post-auricular, retroauricular, or mastoid nodes, and in the tip there is tip of the posterior triangle, there is this occipital nodes.